What is depersonalization derealization disorder? Why does it happen? That's what I'm going to be talking about today. I'm Dr. Tracy Marks, a psychiatrist, and I publish weekly videos on mental health education and self-improvement. If you don't want to miss a video, hit subscribe and the notification bell. Today's video was based on several viewer questions. Jazz the Z says, can you make a video about derealization and depersonalization? Sadie Girl says, hi doctor, could you do a video on depersonalization, derealization please? I came off medication and now have it. Sadly, it's been almost 2 years and it hasn't left yet. Then someone who will remain anonymous described her experience like this. I somehow got stuck in my mind. It was kind of like my physical self was in my mind and I was not able to get back into my physical body. I was swerving on the road without knowing it for a bit and driving slow, then fast at times, almost out of control because I could not physically get back into my body. Obviously, I was freaking out and I kept telling myself I needed to get back into my physical body and out of my head. Like I could visually see myself in my head floating around, not being able to get into my body. I got home safely, but was still out of it for a bit. I was kind of light feeling and could feel my soul being put back into my physical body. Then the light feeling went away and I was present again. I think you can get a sense from her description what this is like. Depersonalization is defined as feeling unreal and detached from your body's thoughts and sensations and actions. It's like you're observing yourself in your thoughts. Things don't seem real. Some examples of this are looking in a mirror and not recognizing yourself, or seeing yourself as an observer in the room. But you can also feel a distorted sense of time, as if things are moving slower, or you can feel physically numb. Derealization is defined as feeling unreal and detached, but this time it's with respect to your surroundings and your environment. And in this case, you aren't looking at yourself or feeling out of body, but your environment doesn't seem real. It might seem like you're in a dream, like it's actually foggy, even though when we dream, it's generally not foggy. But that's how we think of dreams. You can also feel like you're looking at things through a glass or you have tunnel vision. You can also feel like the things that you're looking at are distorted. I had someone tell me that it's like the world is tilted like this. For depersonalization, derealization disorder, you can have either of these or both, and it's a psychological disturbance all on its own. It can be due to something else like medication or an illness. Another key feature of this is that you are able to know what's real and what's not real. We call this reality testing. So you have the experience, but you're aware that your surroundings, you're aware of your surroundings, and you know that what you're feeling is not normal. Our diagnostic manual doesn't put a period of time on this, but we generally would call this depersonalization, derealization disorder if you had these symptoms for at least a month. So it's not something that's just fleeting. Some people, though, will have it pop in and pop out, but some people will experience it all the time to the point where they feel like they've lost themselves or they're dead inside. Depersonalization, derealization disorder tends to start in adolescence or early adulthood, and it would be very unusual for someone to have this disorder for the first time in their 40s or 50s, unless the symptoms are the result of something else. So this brings me to the next point. There are other things that can cause derealization or depersonalization symptoms where it's not a separate disorder. And so you can have these symptoms just come and go. Some things that can cause this are drug use. Marijuana is a big one. Check out this video on marijuana and its effect on the brain. This can also happen, though, with medications such as antidepressants. Sometimes it can be subtle. I did a video on emotional blunting with antidepressants, and I'll link that in the corner as well as in the description. But this flattening feeling that you can't express yourself fully is a subtle form of depersonalization. It's an isolated symptom, though, that can be related to the medication use, and so it doesn't mean that you have this depersonalization, derealization disorder. I had a patient tell me that when she didn't take her depression medication, that the colors in her environment looked dull. Then when she took her medications, everything became brighter and sharper. That's an example of derealization due to depression. In this case, she experienced the derealization or the dulling of colors when she was depressed. You can also see this with medication withdrawal. I did a video on brain shocks with antidepressants, and sometimes part of the withdrawal can be either one of these symptoms, not the brain shocks, but these derealization or depersonalization symptoms, and that's what Sadie Girl was talking about in her comments. Now, Sadie Girl says she's been dealing with this for 2 years. And one possibility, Sadie, is that you have depersonalization, derealization disorder that's not related to the medication. Another possibility is that your depersonalization and or derealization symptoms are a part of depression that has come back now that you're off medication. Of course, these are just thoughts off the top of my head with the little information that I have, but it is something to think about and talk with your doctor about. So you can also experience either of these symptoms with not only depression, but with anxiety disorders like panic disorder and obsessive compulsive disorder. It can just be another symptom that goes along with these problems. It can also be present with personality disorders like borderline personality disorder and avoidant personality disorder. Then lastly, you can also experience this from medical problems like seizures or multiple sclerosis. These are just a couple of examples of illnesses that affect your brain. What do we do about this? If you have these symptoms from another disorder, then the focus of treatment is on the other disorder, because you can kind of think of depersonalization and derealization in this context as like tag-along symptoms of these other disorders. Sometimes, though, if they become prominent enough, like in the case of Sadie Girl, you could address the symptoms separately as its own disorder. If you have the disorder, sadly, we don't have a lot of surefire treatments. But rest assured that as bizarre as some of the experiences are, they're not just a starting point for a more serious mental illness. And it's not going to turn into a full-blown psychotic episode. Also, as physical as they seem, they're not a sign of a brain disorder. These are some of the concerns that people have about this. Some therapies have been shown to be helpful, such as cognitive behavior therapy and hypnotherapy. These are specialized therapies usually delivered by non-physician therapists. Cognitive behavior therapy tends to work better, though, for people who have anxiety with their symptoms. As for medications that we can use for this are selective serotonin reuptake inhibitors, but there hasn't been a lot of robust studies showing their usefulness. And these are antidepressants like Zoloft and Lexapro. We've also used lamotrigine, also called Lamictal, and naltrexone, which is a medication used to help people get off opioids. If someone has a lot of anxiety, sometimes the benzodiazepines are helpful. That's depersonalization, derealization disorder. Leave me a comment about your experience and what's helped you with it. I like hearing from you, and your comments also help others. Like the video if you like it, and see you next time.
I am what I am today, 'cause I did it my way, nothing y'all can say. In this life